The Kashmir region, untouched by the development of our modern world, still retains the natural beauty for which it is known the world over. These communities lack the basic necessities that are taken for granted in the developed world, the most important being healthcare. With no medical care, ailments easily treatable can become fatal. The world, of course, was oblivious to the plight of its people. But all this changed on October 8, 2005, when the region was hit by one of the most devastating earthquakes, killing over 80,000 people and injuring and displacing millions. As aid came pouring in from around the world, many relief organizations zeroed in on the Kashmir region.
I just immediately knew I was going to Pakistan. Just immediately I had a feeling that all these other disasters that I had learned and had experience in dealing with, that based on what I was seeing on the news, that logistically this was going to be the most difficult disaster to respond to because of the mountains.
Todd Shea arrived in Chikar on a 10-day assignment as part of an NGO team to provide relief services. His dedication soon earned him a special place in the hearts of the people of Chikar and surrounding communities. When the relief phase was over, most of the organizations left the region.
It wasn't quite as acute, but that being said, the people long term were going to need this primary health care, the unglamorous part.
He transformed his earthquake medical relief operation into helping the government establish several healthcare facilities for Chikar and surrounding areas.
Up in Chikar, we were the only facility treating patients. There was nobody else. Government infrastructure was totally collapsed.
This effort is out in the middle of the mountains, up above the snow line, and in the winter, we're trapped behind, the roads are blocked by landslides and snow. In the rainy season, in the summer, there's a lot of landslides. It's a difficult area to work in. It's something that people have to understand, that a full effort encompassed by all aspects of an operation has to be in place.
Todd was painfully and acutely aware that the people of Chikar had virtually nothing left after the earthquake. He therefore chose to pursue a volunteer and donation-based operating model, offering primary health care and making available a wealth of medical facilities that were non-existent just a few years before, from routine checkups to emergency situations. Doctors at CDRS managed ailments ranging over skin diseases, gastrointestinal disorders, dental issues, heart disorders, as well as infectious diseases such as typhoid, dysentery, tuberculosis, and malaria. CDRS also extends its arms through outreach programs. Employees of their school health program go to schools to perform health screenings and teach students and citizens about staying healthy.
If we can educate the people, then obviously before they even come to CDRS hospital with a problem, they maybe can prevent some of these problems.
CDRS acts as a buffer for volunteers who are willing to come and help in this region.
Once they land in Islamabad, we pick them up, we feed them, we house them, we give them the supplies they need, and then they work with us.
I didn't know what to expect in the beginning when I came, but just from my travels, and I got a lot of hospitality from CDRS and even along the way.
Right now I'm a volunteer here at CDRS in Chikar. I've been working in the pharmacy, dispensing medications. The facilities here are very sparse. CDRS is working very hard.
A lot has been achieved over the last 3 years. CDRS supported medical facilities successfully managed a grand total of 265,945 patient contacts. CDRS continues to function thanks to the donations from a number of well-wishers and benefactors.
People can go and look at what we've spent our money on. Now, I try to educate our donors and let them know that with that money, we have had to do everything. In other words, we have to feed our staff, we have to feed patients, we have to buy generator fuel, we have to pay the salaries. We have a body of evidence that speaks to our integrity, our honesty, our effectiveness, and our dedication to the cause.
Community leaders and healthcare officials continuously express their approval and gratitude for the critical work that CDRS is doing.
Now, 3 years later, we want to start working on the long-term solution. Empower them, put a system in place that works for them, that is verifiable and trustable and has good systems of accountability and control so that they can believe in that system.
The larger goal of CDRS, therefore, is to create a system that outlasts itself.
A lot of people from different areas where Mr. Todd has sold his idea about how to gain this self-sustained system.
If we show that this system can work, then it becomes an answer for the people for decades to come. And then hopefully in a year or 2 or 3, we've got a system in place that we look around and say, wow, CDRS in this area is irrelevant.
Initiatives like CDRS and its new community-based self-sustainability plan are essential to ensure the existence of an effective healthcare delivery system for generations to come. Not only should the CDRS mission continue, but it must expand to other neglected and underserved areas. This can only be done with the help and support of people like you. Please come forward and support us in our mission.